Here we have Mr. Z, 58-year-old male. Mr. Z came into the emergency room today complaining of back pain and states he has a large mass on his stomach that his wife said he should get checked out. He also seems to be struggling with dysphagia. It was difficult for him to get through a simple history and physical. The patient states that he has a history of hypertension, which he takes metoprolol and hydrochlorothiazide. He says that he's been waiting weeks to get into his primary care doctor about his recent daily blood pressure measurements, and they've been higher than on the higher side. And he has not been able to get it under control with diet and exercise. His past surgical history includes a congenital heart defect, a ventricular septal defect that he had repaired early in life. He also has a family history of heart disease. The patient also states that patient is also admitted to smoking cigarettes, but has recently started to quit because of the expense. Upon examination, we note a large, visible, and palpable pulsating mass present on his abdomen. Based on the patient's medical history, physical manifestations, and my diagnosis is an aortic aneurysm. The back pain and dysphagia is being caused by the mass causing compressions on the esophagus and the spinal nerves. The patient's uncontrolled hypertension puts him in increased risk of rupture and causes increased pressure on the aortic wall, which causes weakness in the tissues. Mr. Z's history of cigarette smoking also is also a known risk factor for aortic aneurysms. So this warrants prompt intervention. A diagnostic test would include a CT, angio, chest X-ray, MRI, and ultrasound for visualization of the vessels. Depending on the size, the treatment plan may opt to monitor with regular imaging. But since the aneurysm is large enough to compress the esophagus, I recommend a surgical repair to prevent further damage or rupture. The surgery requires a transabdominal incision for visualization of the aorta and the iliac arteries. The portion of tissue that has been weakened will be replaced by a synthetic bifurcated graft. I would also recommend the patient quit smoking to prevent further damage to the heart. Thank you.